Adang malungil total merkau loreng sa 87.9 Ego Paradise FM ng Belaw. Madirak kaltirga loreng sirgidra 89.9 el PWFM. Tirga lome sirgidra TV la channel 73 la digital TV la PNCC. Marume sirgidra igal social media. Malungil total legor romer nga el Belaw Michael Belaw. Ebo ko ay silo sel ang trim evidel kapsingil onge del buy le onge del urior teme la press conference sirgid. Tirga lo bangedra el total nga press conference ang aning atanga kal President Rablur Belaw Surang Lwip Junior, madirak kal atanga kal Vice President Rablur Belaw Madam Vice President Che Udo Sambaw Senior, dirak lo bangeda as Chief of Staff ra President Landi Sangotaro, ma Deputy Incident Commander i Osil Kafaru Erbelaw, dirak nga tedel atanga kal okya kal lo bangeda el total nga Captain Eric Vincent, el commanding officer a federal team, ma commander Ed Kuwara, executive officer a federal team, ma direct commander Richard Brostrom, el medical subject matter expert, lo bangedera el total. Bok nga haulan ngum sa brother Wilfred Williams en bolo lulu lo city al press conference del total, bo domu ulo.
Malumit total presidente. Bravo dolulu ang di sa mo iwet trabads yang harap Salma 121 kasi aruba ka usab aklip agumes el moraroy sa ngol ngarigel may ang suwi ang aruba kal may ngigel miledia yang maut diagal bi igaw mapamubu usab aklem adi makar usab aklela Israel sa baklela Belaw ang diakalol ng lokla malubel mi iwayo aruba ka mo ko korngaw dingal bitar kaw em sa akler kaw asil sa diakal tamalaw almalom sa mabuil makalat tamalaw alaklabasay aruba ka mo sa baklaw rarogul tugudala ngut maklaw mandimungil basum mo sa baklaw o may mo moral real ang almoral dia kaula pangalin kadolulu adam el dios lola para kul klisi rayang adama utma agi diol dang sergau emre ngasule mir al tutau kawe ruba kang arbab MCC kapkal etangakla mayang elegel ngaringi rayang adama utma adi kloklem mareng da mang kloklem erubak ele gawa marredla arogul toy arogul si mailteta amlar gaulme magawa marredla arogul toy lobak lisi SBM ruli angidil ap almom si atangak melang agi mereng asulem yol bang sakap kaleng klem agi mereng asulem ratingem giblam iwi el osab aklem el ablur Belaw makamamar adar Belaw men muter al sil sagidil gaselba akla dia kaser marak dem namis sois brablumam mar abamam mereng asulem rangis wal kaul durok kang rabek patengel ablu el mel ngaser komam el la arak tamasela asum mereng ablumam meral tutagi di mereng asulem mal model city al press conference al total gorgau president ma cabinet ringi metiga rogul adang artiang olngi tre da ring argau bolong tiga ge rogul mo motif magel mo nul mo sao rel al sils magi mut dimreng asule olngi tre da ring argau long tiga ge lo sabak rama al mal mutra basengi aiga ont mam odang sam gi molngi tanga klela dios el adam ma dios el ngal ma dios el ring amen
Amen. Ataman misala brother Ipi Wilfred Williams before rabol nunga ulala Chief of Staff el mokmusu sirgi de bogo direklo ay sila se direklo bangedre el total ngartiang Attorney General yak mlode gisam mlode kteli ankler el total di ngobangedre el alchilse di mesegi de COS ak maulal muskam bomdu susiri el total
Umbrella mic. أو إرا وضل ممرا press conference سرقيد دي بقوم ترقيد توسو سرقيد من قضب مالو درسية سو سرقيد للألتوتا المرا أقوال اللي بضول مرا كلاي مرا بقول بيلاو تلك الكوال اللي بيلوم ما أبي ركلاي مرا مسيل بيلاو تلك الدرسية سو سرقيد المرا mga takled ra olbida kalulaw at ang akil presidente ra Senate del Hokons Paules mar Senator Sorogoy ma tilak at ang akil speaker ra House at sabi no Anastasio mar al sangri del al tutaw manda kalobang kita del al press conference direct al malungil tutaw happy belated youth day al morar other bela rokur yan nombre kal al qotulurior yan sumguk na mo dia kam youth el al tal sante to takang al wish happy youth day happy awareness week al morar ngal karaskura bela rokuy malaway se Michael Blalto nga Mr. Lawrence tangaring yar okya karigi dilo bang gedel al tutaw ma press conference kita delegable amo ko mang taratal sikang al dekalwa last week Mr. Clay mo ngi se gido ora special presentation direkal mo ringa te alara germangir mo era bodol mo morse kildraw lawlen mora atangaklet president tergid mo kukal to remarks ng al tutaw
Malungil tuta morar bekl adar belaw marang ayang al mor hot charigi mamli qrabul adar al chil siluk tira sabaril el joiner gidal artial press conference mar tobet sel susur gidan moray budul mar klay mar bugul belaw dilum e bir klay mar masil belaw mar bugul el tira mo taklala blur belaw mar adar belaw al chils كده mal القتلول ان شاء الله متال chils congratulate tara ngalgel ngayas kan ngalgel belaw aga madri gomra landiro sektir ge youth kala adri ge youth dinga ka madri gomra sektir ge youth so lebira time godora they got to realize rase time goes by kada mal mre adan mobile landi ringuda mal dirga madri ge swad al youth mran nongila ngu dal total ukna telira ngalgai bobang elementary uknel ding ang educational awareness week mal you know Maskit sel kadogora mo klar mo de samariar gives us that energy sagit sel malungil mlari ang tarangal kolor menteri vice president radil lo aseng mal soal mo vice president tarak club say malingilon mo dong kraging la sende ang vice mo president di ngalas sugem le International Women's Day la kadok celebrate ngayas kay and you know it's about gida malo moral wase gira drulle abulwad el muriate liran galgeda matira amran momrit magelte ala sabulwad mrat marud el mestrir triga me gulwa jete ase girma la setriga tial blaya blimiu ngani tam lo me protest mendi ungil agera tiab blimiu mo mesem blimiu kada mo meser officer gide ti officer gide rogui mo mansuado welcome arbek la adro asetti agabilmente rieder roguye geder el participatory malsuat sera ngayas ka sel samariar agabilmente como meser trigal atrak lo kyak sang rieder el alsil sen artiang mal bringa sule la ambassador amrigen no sel joiner gid metial timera HHS diguni te bogol go to amrigen lo rak musese mal ukul sim de sengra kada malgoy First of all, Ambassador Neelan, thank you for joining us today on this press conference. And thank you to the HHS team, Commander Vincent, Commander Kua, and Dr. Bostrom for joining us today. This is, as I shared yesterday, January 4th was the light, a ray of hope that we saw. But actually it began before that. When we were on conference calls in Zoom, I remember back in right after the election, and trying to figure out how we could get the vaccines to Palau. And I remember talking about, well, we'll just get a container and put it in front of the gym and bring them all in at once, and let's get everybody vaccinated. Let's declare a holiday and get everybody off and just go get vaccinated. So we've come a long ways. In fact, it's been a year since COVID came into our lives here in Palau and everything shut down. I remember I was on next to the last flight coming back to Palau, which was on a Wednesday night. And then I think, a Friday was the last one. And then they shut down the flights on that following Sunday. So having the vaccine is a very important step in reopening, or we've been open, but protecting ourselves and being able to accept families that have been separated for a long time, hopefully visitors to come and visit, and most importantly, also allowing medical patients to go when they need to go and get treated. I know that there's going to be a presentation by Gafar and Dr. Bostrom later on in the press conference, but I just wanted to say that having the team here has been important for the Ministry of Health, because as you know, the Ministry of Health has been working very hard to get the vaccines out to the public, and just providing some relief to help them get caught up on the many things that they have to do has been just a blessing, and we really appreciate most of all the close relationship that we have with the United States of America, and allowing us to be part of Operation Warp Speed so that we could receive the vaccine. We have many neighbors in Pacific Islands that don't have the opportunity, and I know it's because of that strong relationship, and I call it because we're all family, and that family relationship began after World War II, and it's been strong ever since, and we just appreciate that partnership and that taking us in and saying you're our own and you're helping us in this very difficult time that we're going through. And of course, having the HHS team here just reinforces that and strengthens that. And we just want you to know that on behalf of the people of Palau, we appreciate what the people and the government of the United States has done for Palau and continues to do. So I just want to thank you again for being here. As I said, it's the beginning of a new day for Palau, and really hope for the people that are unemployed and the people that are sick that need to get treatment. So thank you very much. Just to give some background, I'll speak in Palauan again, but thank you, I wanted to share that. Oturulan dimla sokal lo ay surase kadamaral ngal tangat blue ramrige la agil ngeri mo partersel uk program bertil lo top da yobol morar adramrige sedro ase consider tiro ase kadangal gir kadi mol trungal mung trigal adang artialo lo bangia del mle ono sergidra togor omrus a yobo klol ngesala omsa hospital gidra uk trigadro ureoral wal til al tial klol al lungo longolornia al tib longos ngasi mun sebil uk mula gel bebira urerire e continue tialnia obrada ngara al tira al bangari tial trigal other omrus el mlea de gadil other omrus, and maybe I'll just komrina sia Dr. Bostrom ania subject matter expert nge balkul se ase tialuk tora gobi de ngia wal ma tora yobo sedro senya asen masa da gal toe wal semong ra gal toe ويسي غفر سيد الأسمودي ويسي تقول فيلو غفرها سيد مغذري غلغت نغت الغرتيال المسابقة المسكيدة تلقيب الغورة السياسيين لو بنجيلا غفر أجيل أوك ولدسويل جيرلا أوريول مري السيلس ما ملام غتموك ما أولداس ولا سي ما أضمو المملارة أدرى يكريل بلا المي ngarai gel ela kadam already kadam la adra iklel belam di uktomul omesa bebi ratte alra ya disi adra iklel belal me moratte telala doruri eda selba akla mengida tiam lomre gara wigara March 11 trigala damler sera amna mu erul sandel ngartiang namo tamler sel kotulurior tiam lomre gal wig sera alme mloria tele del moda durti retira mosata urere omrus sera omevalurior egada gadoluni trate al material tedel toktang argid maradara ministria heldara ukomara toktang ministria held amlos ilmit Dr. Quarte Dr. Yano Dr. Roberts director Dr. Mogol del hospital maradara tigal director del hospital hable de mit lo mentri tigal adara tim argidara HHS el مساعدة سي غرايجل ونيل بالاسيس الوكيل سيد لاغوت موقل الجيرلا الموت الملارا هذا المسويس بربيلا من نومريكس الميتين الي را اي تاسيل سي غدو كيلومتر هذا والبيل يديرغل لولتوب دا يجي دلولداس ولا سي ميلا السوم قدمو مدار ملارا هذا المين غراوا او نيل تريتال دو يوني Mualangaria edel luldaso el tilo de que gafara más el mo detail del masado dice que lo hace que el masado ara adel ngara Taiwan el merablur belao se tara rael el masado adel ngara kwame adel se adel ngara kwame ngara mrigel bebi rablur me soy el trigel dirigal ngayobo ngara tereta el bodo giungil no si se per trigel material ukmlaya ma yobo ngara wil tretal dol tiraknin mol sisberti mang ngaria yel recommendations bol lol toda gafaran mo ay seguido se gaida agora proposed el amendment el mora a directive ni ngari relal sils lastly direk agora diswado ngate alle bay Askertigan ministry rigid untuk mo skida bir update mo subesa minister obiang ma minister uduyang maria meeting ertire al time gadi dire al dimra el zoom el meeting ngara bebira di mo de gachil joiner rigid di abay ngaria kora basically information el mesola trigaluk vice president ma minister justice rukshelo banget and then the board said presentation so Kabung Vice President.
Malungil total mar peklato rokoy mal mewarong kalmo aisen mulwase sel tokera PIF tamlamok katmok ilang almo kut makli sel official denunciation lo tirakli sel agreement tam establish ra Pacific Islands Forum ma selmle agreement tam laring ya president tam tigal Micronesian presidents with tumlo line up amang el-albalbol mereka marshal engkuk mlamo teme amang tisay dia amle sokal announce ringi mang kita president el angal mo saying shell official denunciation argid mang mo saying ni el-alsil ya mo duro kliko ngal mora ay kita le Fiji this Republic of Fiji a depository gid aktira kal di mo mention lo kom amla mesal nga social media wasi ngani ako kora bebira allegations al gire lengay del milil tal Henry Puna mang koramal mla taknga issues al gire la Mr. Puna mang tamo mesak mula sim el alwaise tel Pacific Islands Forum mang kukmom karar sa ita position ra Secretary General wa all yung el almisa Mr. President.
Sulang Vice Naria gida doltirakra process kada modulu aiser sel el government tra Fiji lo hace kada mo closer embassy di sel wal formal al baber tegi del voto signing ni la di voto takli lo hace adra FSM amlarula va venir adra mashal amlarula va venir amla modars tigit sel wal formal va venir del andina oru magiri basa amat mokla mabilingir mong ay umar wasendik medung to da game amle telbi la ra uktron alam el president ase bastira time bas kwa ma time gimo dura adrol bi ra mama gibom maba imol to ko gimol to da bin ngam se agora amle telbi mga ulang kam kay top da gal babia di kadol tirak karsel ni amle commitment rigid kadol tirak karsel community man le taklo ase al suma adra forma de lo tirak la yel ni amle telbi ra ngamo este aquí da aquí de los tiros clic todo so Alexander ya dormo okay Attorney General kam kwa update ni
and mar guest marada rogui report nga ra MOJ am laring Ababilingira adra Division of Marine Law Enforcement talse lang nga Operation Rai Balangan Maral last 2 weeks ago mo endre el alweek sera ko tulurio ra March 15 yung mlaring atol mortil wasing mlaring dial ra huriping persen labil tigaringira da belbelaw nga ring tablol magkarel bilas direct lul banggel imlek medra fad mang mle 18 na crew sel klol bilas el persen igel tablol magkarel bilas other state el adangara na alsel magimle adu el molme ako kumlel da sama say dil disable igel magkarel dial el lodur kaltril mo remey es el klol bilas ahmal mlemering la deal with it leng ngaring itial kamangal igel persen net edim la kalsal madeng lo seseng telak le mga tela ige ol kon sebe el mo 10 miles mandim la kalsabi il wal tugur tial net matul tamle real ineringi emer kong disable le sel wind seringi mong mode kalsib il mutal sum to sperin de kalsib el mutal really rin emer kong yung Michael rogul klaga dalel mong mode kalsib il speringi edirek kal mle side gaya sa tial persen mong mura huriping. En di segi da waya bol lastra marine law mrula way segi del to el almormada dal sugumto kiatsa bilas el ngara bed etmo label me soisable merbe la ya obisra attorney general ambo o prosecutor igel kuk telmalle la arbe la involve ay gidal illegal fishing ma abilas me mura adabet direct report awaseng mlamom katektet yal ramlik tul ngara surveillance ma 2 weeks ol ko ngari telgibel ko ra issues radial mat hopefully tarasbe il return la kal elang en klukuk ma komsulang di sa igida ko report gid la DMLE
tikora tigibel matakisel nuldaswa au kumra lo hace tigel perseners omlite trin tamarael en beisra situation ng gidra covid de trigam na hori ping gadangar sel edim laka ngigel ngara dial de of course the claim no sing innocent passage se amle e claimer tir di kida other bela mlama orus especially trigal frontliners gida mlama orus agumda sa ngar madadan maral meg kada mo ititril me mura full al lututela al mortir andi kada ngar sel tel tora covid mo siya goramle uldaso ba se hala di tamala klokli lora la kana era tabet edim la kangi lo lab mo seguida uldaso ay si sulang madilungi la da kuide alal mura gafar mal bolse el miskida presentation uri urse edom ura germager diwil germager sulang
Talway sa malungil tutaw Mr. President, Vice President, local cabinet members, Ambassador Nilan, local other ngatiang. Mansulang ratial President talguk mlasa mamil may akumdas ang katingin mera press conference sa dahil vessel administration ko makmal excited last the press conference ako lurio at Belaw tami dir kumle president coming first full circle so sulang tiya nga mal si Seul presentation el blada presenter ngir Eli morar other olbil mang I'm sure to direct mo omes ring ila TV lam direct na recorded a cell session joint meeting il dulbantri Eli Aktimo present baby slides and then Dr. Brushroom can finish it off. Maktimo all taigel gora auriol giblam los amam mutmak terung auriol raigal nomre el telat club siya ngartiang dakal ngang EOC matir. In addition to a rally del guk no se urgi del el marus ra malmol mara rally dra mass vaccination of COVID-19. Mel akda matingel wasik da malungi laurela del mrael ra tokor omrus mung lamo gire del guk komes wase ngaranga next step Senator Dr. Corte amlo dulitiang wase lamo gire del start del mga dadur atrabulur gire la next step which is in COVID safe kada mal ngal tangat del lamo tarak madaringel the COVID free hindi kada matingel wase aloral moklo Clora population gidam rus gidam gegogi del move del open borders en most likely en so is ba a COVID mung ngire del message segi del waseng ranga next step makaranga da adungu selbak sel ngara COVID free mora COVID safe may gagi gel baby ra atokoy malubong teleng tingi lauriol gire del omes gidam usab del ngusa gidel bak sel mora COVID safe Maselgot community readiness. Igel non-pharmaceutical interventions. Igel teleta malubong nguriol sa edel gutmok le gita amarrober arakt amarrober cell community spread. El dakalo spera kar malubong vaccine. Non-pharmaceutical interventions. Igel sa edel gutmok kal sa lablu makuk behavior lagi del lolo kabayra rak temen dia kadungu dia kadoliu leringi se include hand washing social physical distancing igel barriers sel ngarabang kamastawang sel dabong itiram la agut mokla tial ongoing effort try-or partnership lam gila try-or ministry rahel magel gagro sel adal ngatmok tial pandemic certification same direct tara non-pharmaceutical intervention lakad malas al marover sa igid el TL arak tel umpong soy sa brabalwading kada marover sa TL al spread of course igid malmol melomes sa igel messaging ra atokora guru matokora prevention public health messaging ra COVID safe hospital readiness tara atalang tingil auriol gida lomes ringing domes ra ndi kadil capacity ra equipment facility close to tele la capacity ra toktang marnur sa mar adaluri hospital I'm sure ang toktang al amoduli hindi ako osengel ergida mo pulwa se kada ngai rogul dongu adolap adi imol dia kargit sel experience mokra adan na mosmel hindi ka katal da bodo army sa igidi public health readiness kitial malamol marawele tara mass vaccination malungin maral kada malmol malmotmok la surveillance raigal quarantine site sa direct surveillance sa lablu kada malmol malmotmok ra quarantine tiger rogul adal mesoy sa Velaw direct isolation ang aringi sugum moringil first case confirmed madang contact investigation namon nga tung trill incidents sa baed wada dry run malubag the practice sa igid contact investigation or contact tracing tirigel le suspected case malubag the PUI al laringira last year kamar kong gagid long ewang sa igid al policy igid ra tokoira omrael ma quarantine ma testing iwaigel blaldo nga a president patokor omes ra kaldel category ra travelers so do mes tirigel nga Taiwan and May kada meser tigel ngarakwa maguk pebira belul mel mlamrus lango orus ra COVID-19 matirigel ngara kwam mangot al belul diakal Taiwan al mel dirga kalngwa a orus dirga kal complete tersel orus hindi era da bora igay in se edlo mese ogel wase ma atokora testing ma vaccine ngrang impact ringira klamang tela quarantine sel do se quarantine ng adel me mo so isa para abasyon niya kabelmento orur tringi e make sure ndi kal top lo malmi se gid kal sel quarantine sel lo mese testing kita marura pre-testing kita require at time mag require rogul adel mail wase wala masar skogil mervela ang giri submit ra negative PCR test ra within 72 hours ra top der cell balul ngaringin mervela masaya direct kal tara a prevention el gigiringi set el la raktat mura quarantine even for al merabel wat masel recommendation el ang ra CDC asel sugo man dia test raat en girel quarantine 14 days endil sugo mo kadum la test ringi sa igid el belsis ba en sebel mo kadebel mo 7 days hindi gid amal mol ngarsel 14 days la ko komisra ayobo malum vaccine gid amadengel was egal tegid el vaccine el dobang mal bdo el prevent ra adam mal mohidol smer e prevent ra godal ra COVID-19 segid ya gotel mokte ra vaccine prevent ra adam dial salmal mohidol smer e prevent ri men dial mother segid el rakta el at time tadir ka masub lo se ku kwangara klisi el marobra adam dial ngut el rakta malubong oliu ringi endi again ang toktang la direct kal amo sa edlogeringi endi omsuba marar el at time endi segid ya gotel mokte ra a vaccine a prevent ra adam dial bol hidol se malubong mother rakta. And then ang gelong edel point was of course sa madingilo sing nga niya galbes el variant sa al virus el ngaring ya ang nga the sa igid klisi el vaccine. Hindi again I get rokul lomsuba batoka omsuba ngaring el at time el mlamakot mokra last year medel ang hindi mal makasaring yam la peer review they mo publish tamong kadadir ka masu bedir ka omesa batokol teletele la omsubel ngaring rabul adrogil giret tiarakt ma direct giret la gal vaccine semung kada malas malmru la palasirgi del base trege del latest el top de mating to tingel wasing accurate ma ila time sa del exposure ra adal sugum di mimokal marara al sela blur sel ngaring to del mirvelaw a direct kal da to tangali masel guk risk ra adal ngut director al selaskogi mendirek kal da do tangli ndi agel ku koram la top der lom suba akora ul to sing mal ngariu se gidel risk tagida ko atil blel sharing ilo banget tirgal toktang al tara gigi dil bay mlam mok peer review del lom suba lol ultra a risk malubong probability sel adalo liur director after a quarantine sel blood top milak do mes tegid el graph el sugo mendim lak the test segid el pokarkar the line al sugo mendia ka the test raat mal klo TLL el loy wali arak tal sugo mendia ka quarantine segid el chero malubon day 1 mal diri kang arbab sugo mendia ka the test ringi e quarantine ringil mo 14 days ang maral merio segid el risk segid el probability ngel orange al sugo makatuguk ti test ringi selbol mere ka quarantine makadiriyak klomes ringi lo se oral mo budula 11-12 days nga maral mo gagray sa igidil al TLL al loliu ringi al suko mo bang after al top dra quarantine self testing on exit mandirek kalwa so mna kada test ringi ra oral main di test ringi sel top dra quarantine engal mo tal ngariyo sel probability sel oral mo mga time nga quarantine kida la time amrur sel purpol le kada test tira oral may e tester tira top dra quarantine ra 14 days am segidil el mal gegrel te al suguma ata dir ko sme e top dra quarantine el oliu la ngil moral sela blu mora boy لقديمون مرة جيجيد الكلدي الكاتيجوري travelers مقدومس الريسك الأنغان تايوان بابل تي الجرافو تي سل average 7-day average moving average رايدي سلا جيسس رابلورا تايوان مقدومس رينيل مال ملورباب را نقرام ملورباب ملونغرا 5.5 or 6 almost 6 سرا ولا لارق جنواري الليلوت المال موريو مرال موريو التايم مغرا 2 cases average keep in mind ay ga omesin deringi ay gel labatigira quarantine ndi akal ngara alsela bulu ndi ka community spread mang 2 cases agora 7-day average rat abulu rat Taiwan mang based sa igi de kada madingi lo seng mal ngario sa igi del incidence rate sa igi del rate traba esel case el madang abulu rat Taiwan compare del mora kakaros el bulu abulu adeng Taiwan ma New Zealand awal gora masisi awrelel ra tokoy ra quarantine malang ra adults me balura marigel ma Europe at teligibel mi itut saygi del base teligigi del lodengera kuk tokoy ra Taiwan ikodomes saygi del model 1 assumption magada propose lo aset travel bubble abol tokoy Tirger rogul ngarsel skogil nga Taiwan alme agiril mlanga Taiwan at least in 14 days, minimum of 14 days. El blal nga alsel Taiwan. Eselu era top del Merbelao at the tester airport. Hindi giyal 72 hours and sel sa Lorael. Ngirong edad sigang raw el al ngas skogi at tira tester airport. Al sugo negative at si ilmas skogil may. Kadakora omesra initial lidisirar adal me ang 100 tori ra talsko vehicles ko gil me say include our tirgegi del tourist ma direct patients ergidra referral ma escort ma returning residents ma essential workers kodokoro omu ulo mes say gidelo ura 100 tori per flight et two flights per week mga 260 ada mera al sela tal Sunday esel lamay at tangara restricted movement kada madingero sit tirgal tourist tadi makal rogu regel bekkel borngi maigel rogul activity loru la dil atadit mage di ekkel tuklo set morger dagal dil ger de lopri dil porangi dil basyo loru legel sorry tirgal guk adadal medical referral patients malubat returning residents ma essential workers nga Taiwan may adirek restricted movement el 7 days letir kamel mekkay makadakora direct klom das so sige del 7 days sa the tester till make sure mal deka positive and then at the release del momimok modakal nga restricted movement tagi da kuk graph ra kwam sel 7-day average daily cases maral morio January merel ang kadomes ringil maral morio tira direct kalway del sisi already ra vaccination mong direct kalmalungil marala efforts at tira vaccination madomes at graph ra kuk average cases ra kwa men direct kal nga 2 or 3 ra alsela tal Sunday adi close difference ra kwa ma Taiwan 22 million na population ringi o masin regegi del case nga ra quarantine ya kwa ma di 160,000 na population ringi ngaringi ediri ngaringi agay sel ngar alsela bulu masaygi de makaduk kor omesra waigel dilo nga president kadakmulo se kwa mandi mararingi at yang arokul adal diakal Taiwan mangkwam marangara marigel marangara Hawaii ma arwa huriping even masyabal hindi kadaw spare saygi del agel risk level sa kwam el marur taygi del cook strategy mang compare del mora ablura marigel US mainland ng ngario aqua maril at time waigel tilung 2 to 3 ra average ra alsela tal Sunday may lakadomes tirigel mlamarus masugo mga niya adan namarus ra aqua malubong basyo lang ring yesol merbelaw yakadokora proposal sa ngirel lunga orus ay mangil at least ng irul Sunday masate el vaccine el mo orior yamarko diingil ko ra mga sadra apisel sel bulul nga ringi raw er top del may test sa igi del 72 hours sa er nga sa skogi sel domes sa igi del initial el ko ra o uran sa edel domes sa dart del adal tiram lamrus nga skogin may So about 200 ra a month so mong kadamalmol mertegi dil اليوتيرا سكوغيل البسكي دل والرول فلايت سرا السلا تالبويل السلامين دي قلبورا كوارنتين مورا restricted movement يجي دا ماني تورتير تست تورتير سيجي دل day 7 hindi kita amo implementer سيجي دل was selangar سيجي دل restricted movement period ngiri lo mask ra igel borngi di tamal di mora igel الباشيول لا قلبورنgi متاع برسول وابان كما also mangiril mo shopping akali at tamorsay malubang giril mo rawguru at tamir hospital and then as I gidil test negative ra day 7 I released then as last el category of travelers tirigel dirga kalmua orus yaulda so ase kada malmol mal apply sel existing el directive sel existing requirement el di وإرى المين يرول ساندي لون صاد لا بيصير رابلون غارني سيجد التست را day 1 al asabe edel do away with in the at least the 14 days el restricted movement test el 72 hours or el ngas askogin bay kada cap per ay disir ar adel dirga el lorus el may leng direct el gira de lo mesa capacity ra quarantine dirga girin mo quarantine self full el 14 days. Again, di yora yotera askogi es el meta mo so is pertegi el existing el protocol malum practice el test ra day 7 ma day 14 el sum te negative ra day 14 el the release tira next day et el mut 7 days el self monitor restricted movement test ra day 21 el sum negative segi de tira top ra rogul el requirements. Pati di mut el mora el risk mga kama Dr. Brastrom am lodong oklo mesetiang segi del el risk level ra Taiwan ma risk level ra adal nga rakwa melmay el mlangwa orus ma adal dirka kalngwa orus mong segi del ngarbab el table o otil wasel sugo mong mlangwa orus en wal kadakora talgib el dirka bagi kilmak maseng 80% tamararing yal mutal ngarbab 80% effectiveness ra vaccine hindi kada di wasa 80% mangwal nga niya aluy el basent teleleng yal adal el mla vaccinated and may and then nakadaku kung sa gid el test masel mutal additional 80% el protection or prevention مثال دبرت تجد اليور تيبل قدام مثل واسع دمور رجال calculations البيست الريسك رجال التابلو البلو سبقة الإكسبكت الواسع نرى almost 4 million الأذل نرى تايوان المي يجي ذا مؤمتيجر انجل first الكيس انجل one الكيس of course سبقة دي كمير درا كلوغوك نرسل غط الفلايت دي سيجي دي أقول هذا مثل رجيل سيد الكالكوليتو سيجي دي الريت adungura adal nga rakwa mem lamrus ang 3,500 a little over 3,500 tirigel dirkakal lorus 714 masumo kada input taigel idisirar aigel cap passengers el domes domes ay disela flight tala Taiwan al meng ngara almost 40,000 flights ay gidam umasawan el guys tigel vaccinated 36 el flights. Assume the followers say the hotel 2 flights a month 100 per flight es el non-vaccinated el guaman mea 14 tagi da kukora etyanga tia before al merbelaw legado message sel pre-test ma vaccine sel verbelaw sugum hindi ka da quarantine hindi ka da test of course hindi ka additional protection hindi ka da quarantine hindi ka da test madome sa igigid lour ng osisiw lour tungura Taiwan almost 4 million akwa mlangwa orus sa over 3,500 tama di 714 tirigel dirga kalngwa orus so makada mokra quarantine ma day 5 test ng 193.5% protection munguse lour mutal morbap nga oura Taiwan mo 60 million italo mesra kwa almost 55,000 travelers ma non-vaccinated almost 11,000 na kanang tigarawan ng guys. Day 7 na, ng mutal morbabra igel lour. Misal lomes sel klakakarow sila day 5 ma day 7 sel Guam vaccinated. Yung matklol difference sila di 2 days. Misal Taiwan mandirek kul matklol difference. Misal Guam no vaccinated matklol difference. Sige dala at time amrura 14 days sa test mo. Sige dala ko tangariol kalam sige dia o ti agel el probability gida o misal at time recurrent policy. So igay yung kada madangel wasay malbudir ko pato ka unknown mati ka dotangay especially ang nga igal makarosal variants el doreng sa isel rabe kalsils na ber kada bulul adrogi mong ta malogorgi del wasay igal rogul palasil doru lagi del sabaed el change el yidel mo multirak risk ang yidel mo flexible el make sure kada kadol tau tersel atter tele laurier el mora aigel do tangi o eral kun nga Dr. Berstrom medic paskida update sa tokor omrus again number sa vaccines. So as of early 5:30 or 6 p.m. Yakadamlam rus 8,083 adults are first dose. Yeah, since January mirelang cumulative. A second dose adir ka 3,098 and of course the same la more babar el alsil sila kadam de start el marus kadam de resume omrus second dose el alsil. Misal domes first dose coverage belaw adults yung 62% tamlangwa at least yung one dose sa igid percentage adult salmlamo fully covered ang 24%. Atong total population ang 17. Hindi ka damadangel wasing rangal kan ngari oro kira 18 ada kat sabi mga orus. Sa lomes sa regel projections at sum kada malmol lomes sa almalay gel losisiu li disela doses ra gel allocation no gidra bekol buil el albuil ra march amle 5400 may gel dimuk regel 200 el Johnson and Johnson kadala omes ra al selamay igidam la vaccinated 80% ra adult population. So igida ko ra projections rel at time. Kuk nga ulgo yung masanga Dr. B will continue. Dr. Brostrom, if you may continue with the other slideshow. First of all, maybe you could say something if
Sulang Dr. Fauci.
I knew you were going to say that.
It's a great pleasure to be working with Gafar and Ritter and the team at the Ministry of Health. So I want to just start by saying what an honor it is for us to come here and work side by side with the folks at the Ministry of Health, who are, I think that's not right, who are have demonstrated, we saw your numbers were high before we got here. Your vaccine numbers are quite high. And even though everyone gets the same amount of vaccine in the United States, Palau was still number one. What we've seen here when we've arrived is the reason why that's number one, because the Ministry of Health and the executive branch and all of the community is determined and has prioritized this and is remarkably focused and determined, as I mentioned, to get this vaccine out in the way that it's intended. So to get this federal resource, this U.S. resource, into the arms of people in Palau to protect them from COVID-19. So we are really amazed at the work that's been done so far. We are grateful to have been a small part of that while we were here. We look forward to future work together. With that being said, the slide that is up right now from the ministry shows yesterday's New York Times, and there, as I mentioned, number one of the 64 states and jurisdictions, we see Palau sitting at number one. And I hope a little bit of the extra work that the team that we did together this week was able to push that number a little bit higher. So this bubble is a slide. President Whips asked me to use this slide, and this is a slide I've been using since March last year, April last year. And at that time, that bubble meant this courageous decision that you made to shut down travel. So I use this to describe what Palau has done, as well as American Samoa, Marshall Islands, Federated States of Micronesia, to protect their communities from this terrible virus. And at the time, it was a courageous move. We knew you had left family members stranded in Honolulu, in the Philippines, in Guam even. We knew it was going to negatively impact your economy, but it was done to protect public health. And so this slide at that time represented shutting down travel. But I think, as Dr. Corte mentioned, beginning to move towards COVID safe and not just COVID free. And so I think that bubble still applies today. But that bubble, that protection there now is a public health system that's strong and prepared. The PPE is here. The extra ventilators are here. The medications are here, and more are coming this week. And most importantly, the vaccine is here, and Palau is excelling with that vaccine. So that shield is still there, but that shield is now the COVID safe shield. That is a strong quarantine policies, strong pre-arrival policies, and an amazing level of vaccination for the population here in Palau. Here's a slide that we use each week. We update this each week as we talk to the ministers and preparedness programs and the vaccine programs every week in the Pacific region with Dr. Hancock and the team. And so this is a measurement of our race to 80. So we call it. That's each of the jurisdictions working with high priority to try to get this vaccine in. And of course, some of the other islands have great difficulties with populations that live in small atolls, many scattered across the region. Palau has been quite focused and has achieved a high level early. It's in getting to a safe number. And we project, as was just presented by Gafar, that by the end of May, and certainly by early June, you're going to be at a very safe level. This will be the last slide, and this slide shows really the skill and the hard work that has gone into getting the vaccine out. So many of the states are having a hard time making sure that vaccine gets used right away. That it gets distributed to the doctors and the clinics. Sometimes special pods set up by FEMA across the country. Sometimes they go to the HRSA community health centers, of which you have 5 here in Palau. Some are using private pharmacies like Walmart and CVS, which we don't have here really anywhere in the Pacific. Here in Palau, it's the Ministry of Health, and this slide shows how well they have excelled to be using their first doses and second doses and going to the right people. So this slide shows that some of those at the highest risk are getting the vaccine. And certainly as a first measure, we want to make sure that the elderly, that those with non-communicable diseases, frontline workers, etc., are properly vaccinated, and then continue down to make sure we get everyone over the age of 18. With that, Gafar, I'll turn it back to you, sir.
Thank you, Dr. B. Adim lagi agad ang President, nga niya question sa other media. Long it. Sulang.
Hindi ko ito open na wala giril questions and sure ada media up to ka giril giril tiyan. Babol. Sulang. Kabong Mr. Cry.
Is this on? Okay, I'm assuming this is on. Okay. Good morning. My question is to Dr. Rostrom. My name is Leilani Raklay and I'm with the Island Times newspaper. So Kafar had mentioned that there's all these other variants that are, being spreading all over the world. Just recently, was last week, there was a case in Saipan of a frontliner on the border that has taken both dosage, but he was found to be positive of COVID. So, can you explain a little bit more about that and how that will probably affect what's going on right now?
Thank you. That was the question I was most afraid of.
Oh,
So we'll start off with that question. And you're absolutely correct. From our information, we do have someone who received the vaccine. I can tell you and ended up with asymptomatic COVID-19. So this person's not feeling ill, but definitely tested positive. It's very likely not an old case. It's probably a new case. Was exposed to someone that also was a new case. So this is exactly why we're using the vaccine. Again, we know that it's about 95% protective to keep someone out of the hospital if they're infected, okay, or if they're exposed. They won't get sick, they won't be in the hospital, and they won't suffer from severe consequences or die from COVID-19. But we do have that 5% that are statistically still vulnerable to COVID-19. It's an imperfect vaccine, like all our vaccines are. It's very good, but it's not perfect. So to have someone be exposed who is vaccinated and still test positive, unfortunately, is sort of expected. I think the vaccine is what keeps people from getting sick from COVID, protects them, but also keeps them from transmitting it to others. Those who are vaccinated are also much less likely to spread this disease to others, because when they get sick, it's a much lower number of viruses in their body, so they're less likely to spread it. But this is the battle we're doing against the virus. It's an ongoing battle. The vaccine is our best weapon so far. But we do anticipate that the variants will continue to come. We'll continue to have some variants, and each one of them will bring us a different challenge for vaccination, for transmission. All of us are on our toes here because this virus is tricky. So, yes. We're grateful that every one of those cases was without symptoms. In Saipan, no one has been to the hospital, to my knowledge, with the illness, and that the CNMI team there, just like the Palau team here, did very good surveillance. I know that you folks are very skilled at this for other illnesses, where they will do surveillance, contact tracing, like the TV workers are doing in Palau, very much the same. And round people up that might have been exposed, test them, and then isolate them if they happen to be carrying the virus. That being said, I think that the quarantine and testing process used by CNMI, which has been very successful for them, is the one that's being proposed here is stronger than the one that CNMI has used. It's actually, there's higher levels of care, pre-testing, longer quarantine here that should be even more protective than the policy that was used in CNMI.
Good morning, Doctor. I just have two very quick questions. The first one is I understand there are different types of vaccines. Is there a difference between the degree of its effectiveness? And then my second question is looking at international news, we have heard of different variants or strains of the COVID-19. How effective are the vaccines with regards to treating those different variants? I understand there's the UK strain and the other one. So sure. Thank you.
So the vaccine that Palau selected was Moderna, and it's really our Cadillac vaccine. It's very good. There are two. Moderna has a cousin called Pfizer, very close to it, but it required strict cold chain handling and using freezers that Palau now has, but at the time when we began to make this decision together with the vaccine program, they didn't have at that time. So Moderna was selected. It is one of the best vaccines we have. It also appears to work well against some of the variants, but some of the variants have changes that decrease the effectiveness of the vaccine. And that effectiveness may go from 95% down a little lower, depending on which of the variants there are. And there's still testing going on to see what that number really is. But it appears to be very strong compared to some of the other vaccines, very strong, remains very strong against the variants. There's a decrease, but it's still very strong. When the other vaccine that Palau has received, I believe last week it came in, is that right, Kafar? So this is the Janssen vaccine, the Johnson & Johnson, we call it the J3 vaccine. And this vaccine has some advantages, some real advantages, because it only takes a single dose for this vaccine, not 2 doses. And the cold chain, as we call it, the refrigeration requirement is less. So this vaccine is also quite popular. And for people that are hard to get to, people that are on outer islands, for example, where you may not be able to drive out for a second dose to hit them just at the right time, that this might be a better choice. And I think Palau may be anticipating using some of this for folks who are homebound or folks who may be on the outer islands. It's yet to be used, but I think soon that vaccine will roll out for Palau. When you compare the vaccines side by side, which is your first question, which one's the most effective? It does appear that the mRNA vaccines are probably, right now, with the variants that are out there, the most effective. The trouble with comparing them side by side is that they're being compared. They were tested in different countries, and in different countries there's different numbers of variants and different what we call transmission rates for the virus. So it's really hard to put them side by side because this virus is changing and moving all the time. So in general, the WHO has set at least a 50% minimum before they'll approve it. And FDA follows that same guidance. It needs to be at least 50%. So we're using, here in Palau, only the FDA approved, peer-reviewed vaccines that have gone through trials and have been looked at by experts around the world in published results, and really are the most proven effective vaccines available.
Doctor, good morning. Thank you for your presentation. My question is, you've been here for over a week, and I assume you have visited our facilities. You know how many doctors we have, nurses and personnel, medical personnel. If we have one case, you come from a COVID country. If we have one case, we hear, they tell us if we have one case, the hospital facilities will not be able to handle all other diseases. So the question, if we have one case, how many doctors will be involved, or nurses or personnel that you have to isolate from the other cases in the hospital? if we have that in Palau?
Sure. Thank
Can
you.
we cope?
Thank you. I have not been through the hospital with the new changes this year. These are planned for the last part of the week, as the team actually, some of them toured the hospital yesterday, and we plan to deliver some medical education with the team, who has remarkable experiences in the ICUs, in various clinics where COVID has been, the outbreaks have been really quite remarkable, and the teams have come in to really help. The federal team has. First of all, I think here in Palau, as in most places, if you have a case, that case would be found and kept in isolation. And for example, in Saipan, for the cases that have come through Guam, since they started their quarantine in August, they've screened 14,000 people. They found 120 cases. Those 120 cases were found, almost all of them, with no symptoms. They were managed in the isolation. They were kept for at least 10 days, separate from others. Most folks only needed 5 days or so for testing. Those that were found to have positive COVID, they were kept in isolation. They never got sick. They never left isolation. Just like what we're hearing from Taiwan, almost all their cases are not community cases or sick cases that need to go into the hospital, but are managed as outpatients. So most of the time, COVID is like a bad cold or a bit of the flu. But then we know for some people who are highly vulnerable, so the hospitalization rate ranges from 5 to 10% or even lower. I haven't checked those numbers most recently. So that most people who would be found would not need to come to the hospital. So none of these last 120 cases have needed or required to go into CNMI hospital, for example. So that's what you would hope, is when they're found, hopefully the pre-quarantine and the pre-testing and the vaccination requirements will keep any cases from coming and arriving in Palau. If that happened, Palau then would have their quarantine policies to detect that case and isolate them so it would not spread. So your question then is, what if that person was also very sick and needed to go to the hospital? So that's another question. And we have been working since March and April, along with the hospital team and the preparedness team, to get the hospital ready, including medications, including PPE, isolation rooms, ventilators if needed, and then the education component to be able to discuss the case with experienced docs to make sure it was handled and managed well. So I think that in general we have great confidence that if that worst case occurred, that Palau would handle the case well. Then the question is, would you have to shut the rest of the hospital down? And I think that answer everywhere else we have been is no. CNMI, North Guam, when they had their cases, they're isolated to a special area of the hospital, special isolation room, but and kept there. And then the hospital has procedures where only a few nurses will take care of them, and they try to keep most people out of that area so they can take care of all the other patients, the women who are having babies, the kids who are being treated, etc. And they isolate in that area to prevent the spread of COVID in the hospital. So the operations have to continue.
So lang Mr. Salvador, for your answer, for your question. I'll just answer yes, and then I'll ask Dr. Brostrom as a physician to explain the different types that we have. But we do have medication on island for that one case, that first case that needs critical care?
So the first medication you have on island for COVID cases is a medicine you've had here for a very long time, and that's oxygen. They need oxygen, and they need to have, and so you have that already. Okay, so that's not a surprise, I'm sure. The second medication is also one you've had for a long time, and that's the steroid that is used for ICU cases, and that's a medicine that your clinicians are very familiar with. And are able to use, are comfortable with. The next medication they have is called remdesivir, and this is a drug that it's good. It's not great, but it's good. It's shown to be helpful, and that was distributed, I believe, in July. We were able to put that in all the hospitals around the Pacific. We used a lot of it in Guam as well. So there's 3 medications, and the fourth one is bamlanivimab, and this is a new drug, and this is not a drug that's generally given to folks who are in the ICU already, but folks who are ill but not quite needing to be in the ICU. So this keeps them out of the hospital. This is a remarkable drug. This is the one that was given to former President Trump when he was ill, and you have this here, but it's in small amounts. So I think in anticipation of possible need. Again, I don't think you're going to need it. I hope these medications all are sitting on a dusty shelf and never used. That would be nice. But if you do need them, we've been busy at work, and Commander Kua has worked to have an additional allotment, a special allotment brought in, and they hopefully will be coming this week. So I think as important as it is for the medications, it's also important for your physicians to be able to call other physicians who have great experience, and that begins especially this week. There'll be a medical education brought to the clinicians as well as to the nurses, which are also exceptionally key for COVID-19. I hope, again, I think the quarantine and the proposed opening is still going to keep you COVID free. The rest of the work is to keep you COVID safe, just in case.
Thank you, Dr. Bostrom. Based on the statement made by the President and some of our officials, we're planning to start a public travel. And we have been blessed to get this Moderna vaccine by the United States free and the testing. Would this be an international standard to get the vaccination and to be vaccinated and testing to travel? And I was wondering if the United States can continue to support and provide Palau with the testing kit and the vaccine.
So for that second question, I can assure you that in my discussions with Operation Warp Speed, now the operation, and I'm the regional coordinator for that for the Pacific Islands and for Hawaii. General Perna and his staff have assured me multiple times Palau is still and will continue to be in the same line for vaccine that California is in, that New York City is in, until the job is done. So we have that assurance, as even if Palau decides it's going to engage with WHO and take the COVAX or take other sources of vaccine, we're going to continue to support you as if we're the only ones providing vaccine, and we hope that's the case, to use FDA-approved vaccines, right? So the next question then was, what are the travel policies going to be going forward? And I really have no idea. I know there have been many discussions about having a travel passport to assist with travel. It seems like it makes sense. We can imagine that might be a criteria for international travel. At this point, it is not mandatory. And as you know, vaccines in Palau, like we're talking about, with 60% of the population getting a vaccination already, at least starting their vaccine, that's not the case for your neighbors all around the region. They just don't have access to it yet. You've taken full advantage of this opportunity with the United States to jump ahead of the rest of the world to protect your population. And although we all understand that in the end, we all need to be protected. It's a global issue, right? So, so that the travel restrictions, I would imagine, would be dependent on access to vaccine. Ambassador, did you want to add to that? Sure.
Mr. President, Sulong, Madam Vice President, Attorney General, representatives of the media, just very briefly, I just want to echo what Dr. Brostrom said, and I know you want to listen to him and not me, so I'll be very brief. But I do want to just pick up something that the President said, that my wife and I came here on March 19th last year, so almost a year ago, and we were on that very last flight from Guam on United Airlines. And there has been no higher priority. The number one priority for both of our countries, I think, has been keeping our people safe through this very difficult time, the global pandemic. And I want to assure you, and to the question, that the U.S. government is committed fully. I think you see some of that commitment here with us today, to ensuring that Palau is treated as one of our own, as Chicago, where I'm from, or from any other state or territory. That relationship is because we're friends and we're partners. And so we're committed fully to seeing this through. Talking about that moment we saw the vaccines arrive in that dark morning on January 3, if I recall. Now there's a bit of sunlight, that ray of hope we talk about. And it's sunny here in Palau today, and it will only get sunnier because of the work, the teamwork. And then I'll close with just complimenting the Ministry of Health. They really do deserve praise. And to the question, our expertise augments what already exists in Palau. Palau really is a regional leader in terms of public health. You're the model, really, right now, for the rest of the Pacific. And that's because of years and years of dedicated service. Our expertise is going to hopefully enhance what already exists, and we will be available. Truly, what we've been talking about in this visit is not just vaccines, but that next step in terms of clinical care in case, which is very low, the risk, but just in case there is such a case. We're committed to keeping Palau COVID safe. So thank you.
Okay. So the vaccine that's being rolled out is going to people 18 and over. So that means anyone younger than that will not be getting the vaccine. What's the rationale for that? And are there vaccines that will be coming up later for the younger generation?
Thanks. That's a question that's on a lot of people's minds. And of course we're limited with this vaccine, and even the other vaccines available are still not able to vaccinate the children. The Pfizer vaccine goes down to age 16, so in Guam and in Saipan and American Samoa they are giving this vaccine down to age 16. But this is sort of how the approval processes work. It's easiest to test the adults. When we test the kids, not only do we have to test for safety, we also have to make sure we're using the right dose. And so often we approve first with adults, healthy adults, making sure that we have done that testing in folks who are different races, ethnicities, have different comorbidities. And the vaccine companies did a really good job to make sure that people were represented across the board. Now it's time to extend the vaccine down to as low as we can safely go. And the first trials are likely going to be down to 12 or so. And those trials have begun already. Most of them have enrolled already, the members. And we anticipate that the pace of this would be late July or early August, possibly to September, when we have published results. Then it gets approved by FDA and CDC, and recommendations are made. And then we push out the vaccine for children, just like we did for adults, and Palau would be included in that. So in addition, there's another level of testing that has to go on down to even younger, down to age 2. And there were some announcements this week that Moderna is getting ready to start those trials, begin to measure. Again, we have to, the safety has been, seems to be established for adults, certainly. And for the teenagers, we hear that it's going well. And then we have to continue to establish that safety and also find the right dose. Maybe the interval, time interval could be different. There's a lot of variations there. So they're going, but there's also, we know, this is really an important topic. And we want to protect everybody from COVID-19. So I think that the good news is that we're going to be able to give vaccine very likely by late summer, early fall, to expand it down to at least through the teenagers and possibly down to age 10 or age 12, and then go further later in the fall. In addition, we get asked a question a lot about pregnancy. There have been over 20,000 women who have gotten Pfizer or Moderna vaccine. There's no signals right now that it has caused any harm. The studies are not yet done, and so we can't really recommend it. Although many women are choosing to be vaccinated who are pregnant, and that's okay. We allow people, if they're pregnant, if they want to get it, we give it to them. Especially if they're frontline workers or work in a hospital, right? So that appears to be going very well, and again, no indicators that it affects the mother or the baby. But the studies aren't done yet, so we just can't officially say it. And that's pretty soon. Okay, the other comment was about the reason to vaccinate primarily the adults. And that's because children, when they get this disease, often do not get very sick with it. It's mostly the adults and those that have non-communicable diseases or are very old that are suffering in the hospitals from COVID-19. Kids usually do really well. There are some bad outcomes, as we say, with this disease. Kids who got very sick, and some children have died. But in general, the risk is much lower in children. Additionally, the kids are less likely to spread this and to transmit it from one person to another, especially under the age 10. Those children don't seem to spread it very often from one to the other. They just have a lower burden of the virus, and it acts more like a cold for them rather than such a severe illness as it is in adults. We still want to get them vaccinated, but the priority, as we know, is the 18 and olders.
Thank you, Dr. Bostrom. The United States now have 3 COVID-19 vaccine against coronavirus. Can this be used to prevent other diseases like tuberculosis, dengue fever, and HIV?
Right now, the answer is no. But the method for making this mRNA virus, which is working very well, might be one of the tools that finally gives us a good vaccine for TB, for HIV, for dengue. Because as we know, there's really no great vaccine for any of them right now. That's a brilliant question. And this mRNA vaccine may also find its way to be used for other diseases, maybe some cancers. So we're sort of entering a new era. We may retool some of our current vaccines, like for mumps and measles. The vaccines that the Palau team is distributing to the community every day might be improved with fewer side effects using this model. So there's lots of interest in continuing to get better with vaccines. In general, we are amazed at the Palauan population which has good confidence in their vaccines. We know there's misinformation in the community, often from relatives coming from the mainland or maybe from Guam, telling them not to get the vaccine, right? Or worse yet, from Facebook. So it's important that you get their vaccine information from the right source, from the Ministry of Health, from reading about it online, but not on Facebook, okay? Because I think the misinformation has a potential to cause real harm here. It's really important to get this vaccine here in Palau.
Miltutay. Miltutay Rubak, Your Excellency, Mr. President, Mar Other Rokoy. El atyal guk mokorigan mortir selval gulgoring ito Amerikela. Ako kirel tial daptet. Latitan malungi laurel maral kirel tial tokor ospital. Hindi tial daktar. Adal ngar belal matakta. Dakadodel kumut matakta tial vaksin. Alwatir kakabel tu alubit matakta tial lobal marusa imorir. Mang koraw ul makukmle banggela media ay dire kalom teera business community kita tialom dasol kora amat mo karigidel kirel tial opening makora all tour kami we waseng somamel kora kukko mga tibra atara siopay madire kal commune dire kal kora kukmura alila Friday sel kora sunset mixer kuk tokora malasum marura atong mata kalamatak te kuk kolora mongil ka tenge atara air tama atara restaurant tama kuk kolora amotaran dire eta kay nga sel kuk motmok lay kalul to sweat bola ka sal matak el motmok rigid el kirel tial opening masel Palau Taiwan sunset mixer amoringira alilay sel upstairs ra el al Friday March 19 ra 5:30 p.m. Makmal mga tibura kami may ediral elakuk mo extend ringin mortir kal atara ngot albalu. So it's a real pleasure to have heard everything you've shared. It's helping us to be calm and peaceful, and I'm here with the media but also on behalf of the Palau Chamber of Commerce, the business community, and we're planning on a social sort of a Palau Taiwan sunset mixer this Friday, trying to help the businesses to get together and the boaters and people who take people on tours to the Rock Islands and getting them together to feel comfortable and trying to prepare our minds, psychologically preparing ourselves for the reopening. So I guess my small question to you, Dr. Bostrom, was what would be a good advice to people in Palau who are just not, they watch maybe Facebook or conspiracy theories. I don't know why they're afraid of the COVID because it hasn't come in yet, but they're maybe afraid of the shot. What would be your advice to help them to psychologically prepare for the reopening?
Well, thank you for the question. After a year of lockdown, I'm sure it is a challenge to think about opening up again. And in reality, Palau is not opening up. They are carefully allowing selected individuals who have from countries where there's no transmission in the community, folks who are tested, folks who are vaccinated in many cases, as proposed from Guam. So the opening is a careful step towards normalcy, and that might help, I think, the Palauan community to know how careful the government and the Ministry of Health is in taking this next step. Very thoughtful step that's being taken here. And it's anticipation that if the global situation continues to improve, vaccination rates continue to go up, Palau continues to have confidence in how things are going, then the next step is taken as we return towards normalcy across the globe. So I think for the Palauan people to vaccinate themselves is number one. And that we hear from the folks who have been vaccinated that it really is a feeling for them of peacefulness and confidence that they have been vaccinated now. And it's not a perfect vaccine, but it's a very good vaccine. And they feel better about being together and with the possibility that someday there might be a case of COVID. Again, I think the proposed changes are still going to keep COVID out of Palau. There's very low chance that you're going to have cases, given the steps we're taking now. But it's always important to prepare, and to have the hospital prepared, to have public health prepared, I think is a strong priority for the ministry and for all of government.
Thank you, Ambassador. And I really appreciate the good questions from the media. So if allow me to speak in Palau and just to kind of summarize what has been said, because I think it's important what they've talked about. What the ruling kita meran mereka sulit dengan ada abara dan men masih orgi de normal kita dengan doktor postru na dari kan kita get cloud ngeri ngi blago sabi berablu ini yang penting tial urur yang penting tial rak temen cel dengan sing mo cloud mu de mo marea cloud merah gitu masih aigal doru laungile ke dolmol matial lungil doru meng di soal kora abi mo share wase kita Ibang si katam bombe serate alla turis nella Taiwan bombe serate alla arada na quando nei ma igel de dirami igel te alla ala tirgel mea urtu igal iam la mo oltro yang kama nomra toro uro se sel boda ke isang en wati agida te enel te adapta neso iso sel beskida number Misrektal was in 1 in 4 million kasi ang ariate ay 40,000 ang flight ay kala kada ama ng yam amin no but segidal no selutuira ay expert matukta na no mes katwa kita altura kita mega decision kita servoto se wanu dunia de calzada ada temlia belu moise kada mal se waru amin kada صدروا التراد الموصل بأقران الري داخل بجيك كده عم جيجو جيد السيد راسي عم جيجو جيد لو مقرأ أسيمر السيد راسبيرا example 9/11 سرال من 9/11 يا بول مريجن نودي قدام را جيرة الموت الماس أسكوجي جيرة الموت نارودي ديول دي رجال ملونغ ذرا أتريتايل قدام لو مدور بتوع ريد ملو بتوع جيل تيتو كلنgar airport دي كده نام مصماري الواسين كلنgar جيد رابك كالسيلز meng tial melara yobo mlamu uk peser klar giredel melara yobo ngara ulang klautu tra yo sobo aklid meng dia kan warak sobo akltira ngalged meng dia kan warak gada mruri leng nulia balwadan mom sisi gada dire kalmo ngania ka confidence rigid loring so sa hospital rigid akltmok le ngania kan ngaril el sel kut makliat ada sumta ma asmer dire gal ترى مال صدروا مثلا السلايد كده السلايد ومتجاوز عمل نقول إيروري لوليس الواسع 95% الرجال تيرا دوسن غير كتير مالوبة توقع تيجي الواسع هاي ريسك أملا ما يوبورتير الرجال الأقرأ أقول مهم مركير الرجال الأقرأ أقول مركير أقول ما igual va a ser tiram la mayo bortir ese será March 6 el amla el mutel mas ail dois se clau tu tel ngo ti celurera ministry health rieden mal mle karge klom godong ortirgel ade ngoi ti tril me ela kada ayobo doro usir tril ade tiramo possibility brutar tourist no surta metrigel ade el momro tourist ngara tamla certification ortir Malsum tamo handle tiring giri long mask giri makarangale even though ngaria mal gerete al 1 in 4 million at al el meso is berbelaw ding so other make sure say mendiri kada malas mel robbery Ilang seguida rungudo lo hacen de calzada te arracta bel si se prepelao modo mora igel qotel pur babel sebed el sob akliab الوار من اولا كلو توتل سياسي سيل سياسي لو سي دكتور بوستروم قدلاو غاسين بايون لاو دو دغيا بيلاو دي كذا قدم كي قوغي دلو بين النغارا قد ميك شور انجين مسويسم مالي سو قاتين دكتور كوارتيريلي for example au da sul lo mangela blura tayon ase kada tester tire airport Taiwan meng orang ari selul da so ase al sumen 72 hours en ase il goram ligo e gorak mungere mel so ise ba e gida sen dia ela kada close set teal kadingar airport e testering doctor corte ase muadi da sel de bora surgical ward de kada ma ngot ide mo disinfector idura da tura al sela surgical ward seguida concept hoy kada mdangero asen aga covid ra Taiwan mal gare ndi kada mora yer probable سبب هذا الموت الغنيجل ضروري الميك شورا قبل وضع أسل بأك لما قدا كده جير هذا المراجع probable سبب هذا يقمدين لو أسنغاري تيجي بيرجع تنغاري كرابلور بلا الأمال سورين مرمي مقدوني ترقلو رين أرتير ديرك الترامبل الشريعة غفرة سلو أي شيء سملامو التلا الأدر بلاو أملامو سير قط لوروس الشوم بدو التالبوير المي التريال التلا أملامو أميرو لوروس ese ogol merul basen tra adar bela kada mal mla amek me kada oli traklo reng triel ada dar ngare kla blur bela hoy adir kamu ayo borga ome kamora quarantine es el cuarentena erul tela el ma 2100 takostri ngel adal mengiren mohara ni makbadega sing mal klol wal burden blada bastir triela ndi نسيجد الجيد أبتيجار مودرا بالواد يجيد تيرا دا سلب أقل ميريلان ما خدم كي قوجيد maybe سيل تايم البلاد ريتشر سيجد الغداسين 80% يجيد أنا مصدر سين أي يجيد الوك كورنتين يجيد هذا الميريو ومبيتر أدامي تدريج الملامسة لو أسي سترا بروبوزال لو أسي أبول سبيل البلان غايو بورتير يقدر مرسل وك نكسل دا ولو أسي البلان غايو بورتير الميديل يقول الكلبسيل غرا كورنتين دي غرا بليرير دي غلو ما يسرابلو سيمن دي غل ريدوس اكسبنس دي كذا غدولين تراك لو غرا درابلو يجي دام جي غوغيد الاوبن ابلو دي سير كلو توتلا تياجيد كدم لامول دي سو otherwise ni ase adra Taiwan ulingit tre la alsils lo ase ede clock a bolsela adra media da gaisi khramiuns bolsea del announcer ser il corridor lo mgela ablura Taiwan so se agora di best update al sum digia ngodal gere next week uktemem drut msada igel toka ndasem toka question ndi gora malla mo komanga la covid re lang mga malungil om sodele kadam ral di mrenga sule radrablo ndasem tutorial se lolgonia doctor Juarte kadam la covid free ela kadam da sura covid safe ya es el goto cloud tutela ase ndia gal soda ngidil ad al madel covid aul disel gira del mo understanding ya tagid ase ela al sum gada malmol mal wai segid ru dirga gada open agid el teal en dirga el mal cloa arakt rad el digal sim rawguru akti share le nga gamla denwa se tara obisa presenta office of customer complaints mangari adalo den walmelo se gomma yimla listem la mutra listem mas emtengal en se gotel mring el decision ngara radala a refer la committee le kadam delo se di 8 igel el better hospital se en moriara mesel di el 8 se en moriara e di wana flight ra al chat albuil e kadam gara un priority ngel heart en uk mo tingel ngara casino mal merio el casino ma gado ase ndi obol meo de tiel casino ma direk lo berga tia direk al de lungil mangaring gel mo amigo ma batoga igel raktel nga mo kitaro ko mes realiste to al ade di 8 se dem al artin maral tia ntangel mo di se do se trigal little 8 trigedia ngira de lo mes tia rogil sia singerget direk al trigal botogol adal de gaurere ngira del direk lo mda sur trigal mra lo brao de يجد عمال el suadal di white tel dangani relang di gumda social message Dr. Cortese ayel bladrul merelang agotulungin ela ka di ngase ela ka oktobora self esbrudas ula se kadbora covid safe ngari atele la imol me ndil me da selba akla nga trigel dart mo yimel la web trasaibal al build matrir edim la ka aman mosmer why say sel asymptomatic amal mgegare rektir di wa treter kadang klo ablado subi from last till March ermelela godomra la sing mlamo time gadoli traklo lang adra blu ek mringa sing tukar adal suwe bagarandir mal al mringa sular adra media al mlay mo como gira el tukol ger mringa sular adra olbin mal mo tukar ger eli e hopefully gagid al teal a help giden munya klo de gid e mo madar arbes lo kya gid ruk melding rabul wado o man mesulang ya Dios lo mo kaltang tergid rogo lo mo kaltang trabul wado gamar mringa sulala odam rigidra a Mr. Williams el miskidang nungu igido umra sa abelwada asal baak lengal tangat el blue legado Dios msula
era bodong simra president no kasi al president ng siya siguro mo din agora vamos tentar dizer aqui Maria Santos Moses Bureau of Domestic Affairs Patrick Knight lang ang Patrick Sanchez
Benjamin Asuncion hanggang nga CIP office ma Felix Mirep Jr. nga airport ops aviation ma fulda na ito niya nga treasury ra Ministry of Finance magdamal din mutok mo happy birthday happy youth day thank you everyone for joining the press conference. Sulang adra medial guk memo katakaso sa el altsils. Kadabo mga simra ma kildraw la lal morablas ekito takang lal oilil momre kay tapos kol motor.
Otherwise, say once again from wherever you are, yakmang asulem lulmes kamamra TV direct Lawrence kamamra radio. Relogyo 87.9 ng el Belaw ma 89.9 el PWFM. Michael Tokol channels sa digital TV ra PNCC ang channel 25 ma 24 ma 38 ya direct lulmes ng live ra 73 al 2000 ay replay mamra ra urible yakmang asuli o bakal ma station mo bangela Mr. Spider-Man Manu Saulo